early detection of colon cancer. How screening saves lives. As the number of young individuals undergoing screening increases, there's a notable rise in the early detection of colon cancer. Here's how you can reduce your risk. A concerning trend has emerged. More cases of colorectal cancer are being diagnosed in adults under the age of 50. Recent research indicates that the uptick in screening may be linked to many of these new diagnoses, although it does not account for the overall trend. In 2018, the American Cancer Society revised its guidelines for colon and rectal cancer screenings, now recommending that adults at average risk begin screening at age 45, a shift from the previous recommendation of age 50. This change was further supported in 2021, when the U.S. Preventive Services Task Force also lowered the recommended starting age for screenings from 50 to 45. While this adjustment in screening guidelines correlates with an increase in early-stage colorectal cancer diagnoses, it does not fully explain the rise in cases among younger adults, a trend that has been observed since the mid-1990s and includes late-stage cancers as well. Colorectal cancer encompasses both colon cancer, which originates in the colon, and rectal cancer, which begins in the rectum. Elizabeth Schaefer, an associate scientist specializing in surveillance and health equity science at the American Cancer Society, noted in an email that the reasons behind the increasing incidence remain unclear. Ongoing research is exploring a wide range of factors, from microplastics to ultra-processed foods and various gut exposures that have emerged since the latter half of the 20th century. Dr. Joseph Rinaldi, a gastroenterologist at Montefiore Einstein Comprehensive Cancer Center, emphasized that while lowering the screening age has likely enabled earlier detection of cancers that might have otherwise gone unnoticed, there is still significant work to be done to uncover the underlying causes of the rising colorectal cancer rates in younger populations. He stated, "It is probable that factors beyond just screening guidelines are influencing the overall increase in colorectal cancer cases. We need to identify causal factors, whether they are environmental, genetic, or population-based, that can be targeted for prevention and possibly reversing this trend." Recent research from the American Cancer Society, published in the medical journal JAMA, revealed that the percentage of U.S. adults aged 45 to 49 who are current with their colorectal cancer screenings rose from 20.8% in 2019 and 19.7% in 2021 to 33.7% in 2023. Schaefer, who contributed to the new screening study, expressed excitement about this development, stating, "We've been anticipating a surge in screening within this age group. The real excitement lies in the fact that this leads to earlier diagnoses, which can result in less aggressive treatments and ultimately save lives." A second study, also from the American Cancer Society and published in JAMA, found that the rate of early-stage colorectal cancer diagnoses among adults aged 45 to 49 increased from 9.4 cases per 100,000 people in 2019 to 11.7 per 100,000 in 2021, and then to 17.5 per 100,000 in 2022. This represents a staggering 50% relative increase between 2021 and 2022. Schaefer, the lead author of the second study, pointed out, "If screening were solely responsible for this increase, we would expect to see a rise in early-stage rather than late-stage disease." Early-stage diagnoses were quite rare in this age group prior to the implementation of screening, as symptoms typically do not present until later stages. It was indeed surprising to observe the early-stage incidence double from 9.4 to 17.5 per 100,000 in this newly screened demographic. As the incidence of colon and rectal cancers continues to rise among younger adults, public health experts are urging individuals to be aware of the warning signs and to seek screening when they become eligible. Signs and symptoms to monitor. More than half of those diagnosed with colorectal cancer before the age of 50 are not eligible for screening, as they have not yet reached the recommended age of 45. Many individuals who are eligible have not yet undergone screening, according to Jessica Starr, an associate scientist focused on cancer risk factors and screening surveillance research at the American Cancer Society. She was the lead author of the new screening study and also contributed to the other paper. Regardless of whether someone is recommended for screening, it is crucial to remain vigilant for signs and symptoms of colorectal cancer and to consult a doctor if any are noticed. In the United States, approximately 1 in 23 men and 1 in 25 women will receive a colorectal cancer diagnosis in their lifetime. The most prevalent symptom is rectal bleeding, with STAR noting that 41% of patients under 50 report experiencing this symptom, compared to 26% of those older than 50. Many individuals may also experience abdominal cramping or pain. STAR remarked, young people, in particular, often hesitate to discuss these symptoms, but doing so could potentially save their lives. Other significant symptoms to be aware of include persistent changes in bowel habits or stool shape, decreased appetite, and unexplained weight loss. Anyone experiencing these symptoms for several weeks should seek medical attention. STAR advised, if you are young and feel your concerns are not being taken seriously, don't hesitate to seek a second opinion. There are far too many accounts of young individuals being misdiagnosed with hemorrhoids, only to discover months or years later that they actually have cancer. Kelly Spill, a 33-year-old mother, shared her experience of colorectal cancer symptoms following the birth of her first child. Initially, her doctors attributed her symptoms to postpartum issues and internal hemorrhoids. She recounted, "One day I went to the bathroom and noticed a significant amount of blood. It was alarming, as it was not my time of the month. That's when I realized something was seriously wrong." After observing more blood, she documented it and showed the images to her primary care physician, who promptly ordered a colonoscopy. This led to her diagnosis of stage 3 rectal cancer at the age of 28 in 2020. Spill emphasized the importance of self-advocacy, stating, "If I hadn't been persistent, I can't imagine where I would be today, especially as a new mom." She underwent treatment with an immunotherapy drug called dostarlimab and is now a healthy mother of 3, remaining cancer-free. Chapter 11, The Importance of Screening, plays a vital role in reducing the risk of colorectal cancer, as nearly all colorectal cancers begin as precancerous polyps in the colon or rectum. Through screening, these polyps can be detected and removed before they develop into cancer. Current screening options for individuals at average risk include annual or triannual stool-based fecal tests, a traditional colonoscopy every 10 years, a virtual colonoscopy every 5 years, a sigmoidoscopy, which uses a tube-like instrument called an endoscope to examine the lower part of the colon, every 5 years. A separate study published in JAMA found that individuals newly eligible for screening, who were automatically mailed a fecal test kit at home, were more likely to complete the screening than those who were given the option to choose between a colonoscopy, a fecal test, or deferring screening. Schaefer, who was not involved in that study, raised an important question. How can we increase screening rates, particularly among those without access to healthcare? This group showed no significant increase in screening in our study. Despite the recent uptick in screenings, it is estimated that over 1/3 of adults aged 45 and older are still not receiving the recommended screenings, according to the National Colorectal Cancer Roundtable. Additional preventive measures. There are several proactive steps individuals can take to help prevent colorectal cancer. STAR noted, people of all ages can reduce their risk by avoiding smoking, maintaining a healthy weight, staying physically active, limiting alcohol consumption, and following a nutritious diet that is low in red and processed meats while being rich in whole grains, fruits, and vegetables. According to the American Cancer Society, more than half of all colorectal cancers in the U.S. can be attributed to these modifiable risk factors. Rinaldi added, numerous studies have sought to identify factors that contribute to the development of colon cancer. Leading a physically active lifestyle and maintaining a healthy weight are crucial, as obesity has been linked to early onset disease. I also recommend avoiding tobacco, refined grains, and sugary drinks, while focusing on a fiber-rich plant-based diet that limits red and processed meat consumption, as this is believed to be protective for colon health. Early detection. How younger people are finding colon cancer sooner. Imagine this. Young adults are increasingly being diagnosed with colon cancer. a disease once thought to primarily affect older individuals. For decades, people under 50 have been showing up at doctors' offices with alarming symptoms like blood in their stool, abdominal pain, or sudden weight loss. The culprit? Colorectal cancer. Tragically, by the time these symptoms appeared, it was often too late for effective treatment. But here's where it gets hopeful. A significant shift is happening, especially for those in their 40s. Thanks to increased awareness and more proactive screening measures, younger people are catching colon cancer earlier than ever before. This early detection can make all the difference in treatment outcomes and survival rates. But here,